Hello, welcome to Fibro Warrior, My New Normal. I'm MJ Aragon, and I'm here with my producers, JoJo Merrick's and Tony Jeffries.
Wow.
Today, I want to share a blog and by Melissa Swanson and a few comments that posts and a few comments actually. I'm going to share them anonymously, except for Trudi because she's the one that posted it and said it was okay. But everyone else, I didn't want to throw everyone's name out there. It's a private page. But I did want to post the comments so that people can get an idea what everyone's dealing with. And so because our dental health is such a big deal, a lot of us are afraid to go to the dentist because well, for one, you don't want the bad news that you know you're going to hear, and two, working on your teeth, it can be very, very painful for a lot of us. So, anything that involves some pain, we're trying to avoid. We deal with enough pain every day. So I wanted to read the blog that someone wrote about her experience, basically, and it's called Fibromyalgia in Your Teeth, and she is her name is Melissa Swanson, and I'm going to read that first, and then I will read the original post, and some comments that were afterwards. So here we go. Fibromyalgia in Your Teeth by Melissa Swanson, www.prohealth.com, and this was written on April 18th at 2:15, and I will post the link to this on the podcast when we post the podcast. It was reprinted with the kind permission of Melissa Swanson and Fibro Warriors Living Life. Okay, I will admit this is not my typical blog. Stick with me through the facts and I will get to my story. I feel that it is something those of us on medication for our pain, depression, anxiety do not think about. Dry mouth is a common side effect of those drugs. Without saliva, tooth decay and gum disease are more likely to occur. Individuals with any form of arthritis-related inflammatory disorders, fibromyalgia, for instance, or autoimmune disorders are at high risk of developing many diseases of the oral cavity, including, but not limited to, developing periodontal disease, more than twice as likely as others, developing severe jawbone loss, moderate to severe. Extractions average 12 missing teeth in studies. Researchers at the University of Maryland Medical Center published findings linking periodontal disease to autoimmunity on October 2010. This evidence of autoimmunity explains why regular flossing helps prevent periodontal problems, and it also explains why some people are affected by periodontal disease more than other people. This theory can also be linked to the fact that the risk of both periodontal disease and autoimmune disorders increase with age. In periodontitis, gums pull away from the teeth and form spaces called pockets that become infected. The body's immune system fights bacteria as the plague spreads and grows below the gum line. Bacterial toxins and the body's natural response to infection starts to break down the bone and connective tissue that hold teeth in place. If not treated, the bones, gums, and tissue that support the teeth are destroyed. The teeth may eventually become loose and have to be removed. Of course, if it's a possible side effect, aka evil sidekicks, of fibromyalgia or a treatment, I am likely to get it. I had been experiencing dry mouth for the past few years, thanks to medication, approximately a year and a half ago. I had been told that I had the start of periodontal disease. The hygienist found I had more than several teeth pockets, 5s and 6s. I brushed my teeth twice a day, but honestly only flossed for the week before my appointment. 6 months later, I returned to the dentist. I began to floss more frequently and had proven to work. All of my 6s were lowered to 5s. So this week, here I am again, another 6 months later, sitting in the dentist chair hearing the lecture, Why to Floss? She told me I was bleeding a lot. I told her it was normal. Individuals with periodontal disease may experience bleeding of the gums when brushing, which is often the first sign of a problem. Floss for a week, and the bleeding will stop. She continued to explain one theory is that the gum disease can cause bacteria to enter the bloodstream where they attach the fatty deposits in the heart blood vessels. This condition can cause blood clots and may lead to heart attacks. Once the cleaning was done, it was time for Dr. Mike to examine my teeth. He asked if he was walking in to find good news. Of course, I deserved a gold star. The good news is that I have lowered all but 4 of my numbers to 4s and only had 4 5s left. I went on to tell him he was my favorite doctor. Not only did I not get diagnosed with a new syndrome condition or disease, but my health had improved. Even better, I leave with a new toothbrush, floss, and a compliment. You have beautiful teeth. This is one of the sidekicks of our invisible illness. that is invisible and we have the power to control. Drink lots of water and floss daily. Melissa Swanson is a chronic pain patient, advocate, and author. Through her Facebook page, she offers positive encouragement, medical information, resources, and supports 10,000 plus fibromyalgia and chronic pain patients. In addition to her own blog, Melissa has been published in Living Well with Fibromyalgia and the NFMCPA Advocate Voice. She is a graduate of the 2014 class of Leaders Against Pain Scholarship Training sponsored by the National Fibromyalgia and Chronic Pain Association and is a member of the Leaders Against Pain Action Network. You can find Melissa at Facebook, www.facebook.com/survivingfibro, or her blog, www.survivingwithfibro.wordpress.com, or Twitter, Melissa Swanson, Melissa and Swanson both capitalized, number 22. So, if you are dealing with those things, and the doctors all probably tell you guys the same thing, and I've heard it many times that flossing is important. Now, if you don't like manually flossing, I actually went out and bought one of those electronic flossers where they squirt the water. Why can I not think of the name of this right now? You guys know what I'm talking about? Where it uses the water. Water pick. Thank you, Tony. Water pick. I went out and bought one of those water picks because I don't like flossing too much. So, not all of my teeth are tightly pressed together, but the back section of my teeth are very tightly pressed together, and it's really difficult to get the floss in now, and it bothers me, so I hate doing it. So using the water pick makes it much easier. It has helped, and my last visit to the dentist, I was told that my teeth are in great shape, except for, with one exception, I had one cavity in one tooth, and that was a tooth that was filled, so who knows why I have a cavity that was filled long ago. So I'm not going to worry about it because I'm going to use it for a bridge, so it's going to be, it's going to be, what's the word I want to use? I'm still having a brain fog. They're going to make it into a post, so it's not going to matter whether it has that cavity on it because that part's going to be gone. Excuse my voice. So anyway, I wanted to share this because it's important that we think about our teeth, because I know that it usually ends up being the last things we worry about because we have so many other things, but our teeth are important because people see our teeth. When we look at people's face, we usually watch their mouth talk or look at them in the eyes. So when we're watching them talk, we see their teeth. And if your teeth are in good condition, it's very noticeable, especially if it's your front teeth. So my friend Trudi, who is also admin on Dear Fibro, she wrote this post. It goes like this. Okay, peoples, here's a new poll. Every time I go to the dentist, more of my teeth have either broken beyond repair or I need several fillings. Who else here finds that fibro affect your teeth? Or is it just me? Big loves and smushes to y'all. So next I'm going to read, I don't think I copied all the comments because people still kept commenting afterwards, but I copied a few because I wanted to share with you all what other people are saying and what they're dealing with. These are all anonymous. I'm not sharing anyone's names, but I'll let you know when it's a new one. So here's one. Me. Can't believe, not me, but me can't, I don't know why I should put me. I can't believe how bad my teeth have become and how expensive it is to get the work done. Next one. After being traumatized at 24-year-old by a dentist who put me into shock, pulling wisdom teeth that were too impacted to remove, unsedated, he refused to put me under because I hadn't watched a video. It was an emergency procedure. I haven't been able to work myself up to seeing another one yet. Puts me in a panic attack every time. I am sure my teeth are awful and have chipped ones so far. Next one. I'm not even 30 and have partials. My dentist says it's because my enamel is destroyed between medications and my nauseous flares of throwing up for days on end. When they did my deep cleanings, everything looked amazing because I take good care of my teeth. But because of circumstances I can't control, I've lost a few, and I need to cap all of my teeth to put some kind of protection over them. It's frustrating and honestly hard to deal with, but like all the other symptoms, we find a way to keep going for any quality of life we can have. It sucks. It's miserable. It's not fair. I spent twice a week, every week for 6 months at my dentist's office, but I'm alive and hopeful, so I'll take what I can get. Next. It's me too. I get stress-related pain from fibro in my jaw and it goes down into my collarbone. I had a broken tooth out in 2017. Another one. I lost all of my teeth at age 28. 28, can you imagine? This is from me. This is me. More so, it's my jaw with TMJ and the nerve pain that makes you feel as though you have a toothache, but nothing terrible yet. And and that I'd find unusual. So my dentist visits aren't bad. I feel for all of you that are going through that. Trudi mentioned hugs. I've been lucky. I have not had anything major. I did when I was younger. I had to have a root canal done that went bad, and I ended up having to remove the tooth. So I need to replace that tooth. I kept getting around to it, and then I had another one removed. So I have one bridge on one side, and now I have to have another one on the other side. Aside from that, I've had some fillings, which luckily I have the white fillings, so you can't see them all, but I had quite a few. But as I got older, I started paying more attention because although I ate very healthy, I did like sweets, and I think that was my downfall. I ate a lot of sweets. And now that I say that, I drink a lot of energy drinks, and that's terrible for you. And so I think that those did a little damage as far as cavity wise. But other than that, and the TMJ that I experience, and the nerve pain, because your nerves go up into your teeth, so it feels like a toothache. It feels like you're having a toothache, but it's not. It's just the nerves firing off, and sometimes that will go on for a while. Sometimes it just happens occasionally. Either which way, it freaking hurts. But thankfully, I say thankfully because it could be worse. That's all I have to deal with. My teeth are in pretty good shape. I had a really good visit last time. They cleaned my teeth and said they were good, except for, like I said, that one cavity. Someone else after me wrote, yes, I'm currently having to have root canals on all of my back teeth due to nerve damage from having an impacted wisdom tooth out. Since having fibro, I've had lots of dental work. My dentist can't figure it out. There's no decay, etc. And here's another one. In almost 2 decades, I suspect I've had fibro. My teeth have literally just fallen apart. I went to the dentist for a while. Every visit seemed to make things worse. I have them broken under the gum line. I'm now missing a front tooth. They just collapse with no outward signs of decay. I'm too ill and too terrified to go to the dentist now. And the next one is, I've had FM for almost 15 years and have the same problem, especially within the last few years. I've cracked about 5. Next one, hitting puberty, my teeth have gradually disintegrated. Next one, definitely not you. I have broken ones, missing ones, infections, lumps, and all sorts, and now teeth and jaw at very high risk as a preola for my osteoporosis. The next one is, I just went to the dentist. I need 7 crowns, 2 ASAP. One of the 2 that need to be done right away is already broken, and the other is cracked and ready to break. I have dental through my work, but that's still $500 a tooth. Don't know how I'm going to pull that off. I'm not a fan of the dentist after having wisdom teeth removed and being black and blue from the dentist pulling on me. It causes me to have panic attacks every time I have to go. I go about every 6 years or so. Next one. You are not alone in this situation. I have teeth that have broken, chipped, and need several fillings, and possibly need crowns and/or bridges. The enamel on my teeth is worn away in several places. My teeth were never this bad before, but due to dry mouth issues from medications, I chewed a lot of gum, sucked on hard candies, and also drank a lot of pop and coffee. I don't have dental insurance, and the cost of dental care is very high. Most dental offices that I have called all require payment in full for work done on the day of your appointment. It is getting even harder to avoid dental care, but I need it done too. So those are all the ones that I kept a copy of. I will say this, I don't know about all dental offices, but I know some, and I don't know what all of our credit look like. Some of us probably still have good credit, some may not, because the struggles that we go through and bills that we have to pay. But they do offer, some offices, they offer credit there, where you can get this credit and then pay it off. But if you don't pay it off in a certain time, it is at high interest rates. So you have to be very careful to make sure that you pay it on time. I don't know if this is feasible for some of you. Some of you may be, some I'm not. It may not be, and I'm really sorry. I wish I could offer a better solution, but I had to use this actually myself to get one of my crowns, which reminded me. I was reading one of those. It reminded me my crown was terrible. I totally had forgotten about what a long day it was. Everybody's really sweet and nice, and thankfully we had a PPO at the time, so I had a private room, and I wasn't, stuck in a room with a bunch of people, which, when you're getting stuff like that done, you kind of want privacy. So I was lucky that I had privacy, but because it took them so long to get this to fit. Now this was the second crown I had done. The original crown was not put in there properly, and after a couple fittings, he couldn't get it right. So I dealt with that for a while, and so finally I went back in because it cracked, and it cracked right in half, and so that was just asking for an infection. So I had to go get that done. It was important. So they pulled that one out. They had to file my teeth down a little bit more. That's the word I was trying to think of earlier. They had to file my teeth down a little bit more, make the posts even smaller, which means your teeth are even more sensitive, and then redo the bridge. Now, the bridge is, it's not fun to put in because they put it in, take it out, put it in, take it out until they get it right. And apparently this one wasn't sitting quite down far enough like it should have been. So now my jawline, my teeth are actually leaning a little bit to one side because of this, so I'm hoping when I get the other side done, it will even it out. But I noticed that there's a little bit of a tilt that I didn't have before. And I remember one day, I was out with my honey and I laughed and I covered my mouth and my ring hit my tooth and I chipped a little bit of my tooth. Not the worst thing that could happen, but it's things that you notice when you look at yourself in the mirror. We notice the little things that not everybody else would notice. So I'm a little disappointed in those two things, that that my teeth are crooked in this fashion, not crooked like bumping into each other, just that my jaw is offset from the crown, or not the crown, the bridge, and also just the whole ordeal. I was in there, I'm not exaggerating, for 8 hours. I was in there for 8 hours from the moment I went in with the x-rays and everything I had to do to all the stuff. Oh, actually, they did that the first visit. When I went back in, I had gotten the order of the crown, the bridge back in. So putting it in, literally from the time that they started working on getting it in and taking it out and redoing it, 8 hours. I was in there for 8 hours. I was so exhausted. I was so pale. I felt so bad. And they could see that I was feeling bad. And they were aware. I let them know I had fibro and things I was dealing with. So they were actually very, very careful. Instead of making me feel like they didn't believe me, they were much more careful and understanding. And at the end, because it took them so long to get this thing in and get it in right, well, somewhat right, they actually gave me some teeth whitening. And I didn't really need it because my teeth were right below the whitest shade, so I didn't really need it. But they're like, here, this is our gift to you for you being so patient, which I don't even think, I think I used it once. But it was nice of them to acknowledge the fact that, that they put me through a little bit and I wasn't feeling good, and the fact that I was patient and I didn't complain because, they were doing the best they could. I mean, sure, it could have been quicker, but things happen. Anyway, so like the lady said, Melissa Swanson, in her blog, I know that flossing is really important. I'm not saying that that's going to fix your problems, because we have deeper issues, some of us, than just flossing our teeth. We have things from the inside that are causing the teeth to decay, I imagine. I don't know a lot about it. This is not something I've done a lot of research about, so I don't have more information. I apologize for that. But I did want to share the experience everybody's going through, so that that you're not the only one going through that this is something that's happening to a lot of us, and it's difficult to deal with. And like I said, your teeth are something that we see, it's something that when you look at someone, you talk to them, it's something you notice. So I know that if we have teeth issues, and especially our teeth that are in the front where everyone can see, you want them to look their best. It is important to brush your teeth every day, and of course floss every day. And then, like I said, if you don't like using the floss, like I don't, the water pick is a good alternative. And I think you can get it at, well, back in the day, I don't know if they've probably gone up in price, but I bought mine at Bestbuy or something like that, I believe, and then you have the 20% coupon, so it ended up costing like $45-50, I think, for it. And it's been really wonderful. And I even put because I use the Tom's Natural mouthwash and toothpaste, I put a little drop of the mouthwash in the water in the basin, and so that way when you're doing your teeth, it even feels a little bit fresh. And I don't think you can use any mouthwash, but I know that one is okay. Anyway, so I hope that those things helped you guys, and that you understand that you're not the only ones. And if I do have time to do a little more research on this, I might just make a little post on my Fibro Warrior page, talking about details of how you can try to prevent it, or find out why it's causing us to have so much tooth decay and our teeth breaking and things like that. It's not fun. Anyway, so I will see you guys soon. Once again, if you guys noticed, I wear the same thing. We've been doing the podcast 2 at a time, so we have a couple there. Each one's back to back. So 2 as we go through this season. So if you see me wearing the same thing and you're like, Is this the same video? It's not the same video. This is number 2 of me wearing this this outfit. Anyway, I love y'all. You guys are amazing. Thank you so much for your love and support. And you are not alone, and neither am I. Love y'all.